Today we'll be discussing the Brazelton Touchpoints approach and how it can be related to the professional field of speech-language pathology. This presentation was created by myself, Emma Fountain. What will be covered? So we will first discuss speech-language pathology. We'll do a brief overview of the roles of an SLP and what an SLP is. Then we'll discuss early intervention programs, and then we will take a peek at an article I found that describes the guiding principles of early intervention, and then we will apply the Brazelton touchpoints to the guiding principles of early intervention. What is a speech-language pathologist? So, a speech-language pathologist focuses on evaluating, diagnosing, and treating communication and swallowing disorders. This profession is often described as a birth-to-death profession since SLPs work with individuals of all ages to improve their speech, language, voice, fluency, swallow, and communication skills. Early intervention programs. Early intervention programs support infants and toddlers ages birth to 3 with developmental delays or disabilities. These programs aim to promote child development and provide family support during early years. A team of professionals including, but not limited to, speech-language pathologists, occupational therapists, physical therapists, and educators offers services to enhance children's abilities and help them reach developmental milestones through individualized and family-centered plans. And we will be focusing on early intervention and SLPs in early intervention since this is the area of study that I would like to work in when I graduate from grad school. So this article is from the American Speech and Hearing Association, and it does a wonderful job at describing the guiding principles of early intervention and demonstrates how speech-language pathologists can apply these principles to best serve infants and toddlers with communication problems. And we have our 4 guiding principles of early intervention on the slide as well, but we'll go into more in-depth in those in the following slides. Oh, there we go. So applying Brazelton touchpoints to the guiding principles of early intervention. So our guiding principle states that early interventions must be family-centered and culturally and linguistically responsive. So this aligns with the Brazelton touchpoints principle of valuing the relationship. So we always want to value the relationship, and we can make our practices family-centered by valuing the relationship. We can do this by collaborative goal setting. So during our IFSP meetings, we always want to make sure that the caregivers are playing an active role in setting realistic and meaningful goals based off of child and family strength. And we can also do this by always encouraging family involvement and family coaching. So always be looking for ways to involve family members into treatment sessions, and to always recognize that the more a family is involved, the more likely a child is to meet developmental milestones. Our next guiding principle states that early interventions must be developmentally supportive, promoting children's participation in their natural environments. And this aligns with the Touchpoints principle, look for opportunities to support parental mastery. This can be done via family education and support. So the biggest one, and the one that's most recently on my mind, is anticipatory guidance. So we always want to make sure that we are providing families with information about upcoming developmental milestones their child may be reaching and some of the challenges that may present with those milestones. That way the parent can know how to help the child work through these developmental milestones as they reach them. Our next principle states that early interventions must be comprehensive, coordinated, and team-based, and this coordinates with the Touchpoint assumption that each provider is an expert in the context of their practice setting. So we always just want to be aware that everyone has the same goals for the child, and that everyone is trying their best to reach the goals. And then our last guiding principle states that early intervention must be based on the highest quality of evidence available, and this aligns with the Touchpoint assumption that all providers want to be confident. And this is just a great reminder that we always need to be continually researching and educating ourselves as we practice. And then I have my bibliography. Thanks for joining me.